All right, so now we're going to talk about the don'ts of jaw pain. So the first don't of jaw pain is avoid excessive yawning. So the reason why we recommend this is because excessive yawning causes your mouth to open very, very wide. When your mouth opens wide, it places a lot of extra tension on your jaw muscles. And not only does it place tension there, it also increases the stress on the TMJ joint itself. So two strategies you can use to decrease the excessive yawning is the first one is going to place the tongue on the roof of your mouth and yawn. So by doing so, it prevents you from opening your mouth to its maximal capacity, and it is almost protective in nature. The other thing that you can do is place your fist on the bottom of your jaw. So it causes you to not have to open up your jaw so wide. Okay, these are two great strategies to help avoid excessive yawning and to decrease some of the tension on the jaw joint. The next thing that you can do is stop clenching your jaw. Now, most people don't realize they're clenching their jaw, or at least they know they're clenching, but they don't do anything about it. So one thing that you can do to stop clenching your jaw is to make mental note of it. All right, so pay attention in times of stress, because most likely this is when you're going to experience some of that clenching, is during times of high stress. So if you're in a stressful situation, do your best to remove yourself, or at least if you're stuck in that stressful situation, make note of, am I clenching my jaw? Okay, just relax. Do a couple breathing exercises, and then hopefully you can control that clenching, and then you can stop yourself from having a flare-up later on in the day. One of the other big topics everyone talks about is clenching at night. How do you stop it? Well, a lot of times people will go out and spend lots and lots of money on expensive dental guards, custom dental guards. They'll go to a provider, and that provider will say, hey, you need this. And not always do people get relief from them. As a matter of fact, very seldom do people actually find complete relief from having a dental guard. So I usually recommend people buying over-the-counter one first. Typically it's a lot cheaper, it saves them money, and then at the same time, if it doesn't work, then you know you might need to try something a little bit more expensive. But I would always say start cheaper and then move to more expensive later on. You can find these at CVS, Walmart, Walgreens, pretty much anywhere that carries any sort of low-grade medical supplies. And then lastly, I would say avoid eating chewy objects. Chewy objects are tough on the jaw muscles and on the jaw joint. They can increase tension in your masseters here, and then also your temporalis up here. So for you folks who get headaches behind your eyes, headaches in the front of your head, and then also in the back of your head, this could be you, okay? Do your best to avoid eating chewy objects. Focus on a soft diet. So these are the don'ts of jaw pain that I'd like you to focus on. I know these will get you some relief. If you have any questions, please feel free to reach out.